So I am very pleased to have Ms. Engler here today and to say thank you very much for being here. We welcome hearing from you and hearing the personal story that you have to tell. You know, it's powerfully important here. I want to thank the chairman and the ranking member for holding this hearing. This is a serious problem, and it's a problem that's getting worse. According to a 2012 study published in Health Affairs, the number of Medicare patients who were in the hospital for more than 3 days under observation status increased by 88% just from 2007 to 2009. And the Inspector General reported that over a quarter of the 1.5 million Medicare observation stays in 2012 lasted for more than 2 nights. You know, the reasons for this increase are complex, and this afternoon we're going to talk a lot, I know, about billing and coding and admissions and prospective payment systems and audits and all the ways that we can fix every one of those. But while we talk about those things, I know that we're going to work hard to stay focused on what's really important here, and it's making sure that seniors get the care they need and can afford that care. You know, that's the promise of Medicare, and if we're letting some of our seniors down, then we need to fix it. So thank you all very much for being here. Thank you, Ms. Engler, for being here. We're very much appreciate it. It's so important to hear personal stories about how this affects people. Some seniors need additional care at a skilled nursing facility after leaving the hospital before they can return home safely, as Mrs. Engler so eloquently pointed out. And that's the reason that I am also a co-sponsor of Senator Brown's bill, along with Senator Collins and Chairman Nelson and Senator Baldwin. But I see that as a good start. But we also recognize that some seniors need skilled nursing facilities without spending any time in the hospital. In 2010, as part of a CMS care management pilot program, Massachusetts General Hospital allowed patients to be sent directly to a skilled nursing facility after evaluation by a doctor. These were patients who needed rehab after a fall or needed some extra care to recover from an illness, compared to similarly situated patients who were sent home instead of being directly admitted to the hospital, from the hospital to the nursing facility. Patients in the pilot experienced fewer subsequent admissions to the hospital and cost Medicare less money over the subsequent 60 days. So I understand that the 3-day rule was put in place to try to protect against overutilization of highly specialized care. But I also understand that we're trying to move toward a payment system that rewards for value and not for providing unnecessary services. Today, almost all of the pioneer ACOs, including Massachusetts General Hospital, waive the 3-day rule. So given the results from pilot programs like the one at MGH and the ongoing experience of our ACOs across the country, do you think that a 3-day rule is still the most appropriate measure of the need for a skilled nursing facility? And I thought I might start with you. Ms. Borgstrom?
I have a little bit of familiarity with the Mass General's experience, and again, I will say as a non-clinician, no, I don't think that the 3-day stay is a preparatory requirement for skilled nursing facility makes sense. And in addition to what the pioneer ACOs permit, which is direct admission to skilled nursing, also in CMS's experience with bundled payments, we're participating in 11 of the bundled payments. You can admit patients directly to skilled nursing if you want. So, you know, I think it gets down to the economic issue versus clinical judgment, because clinical judgment in the case of the Mass General experience said these patients will do better and will bypass the inpatient environment, and for older Americans not go through the confusion of, you know, being moved on 2 occasions. And, you know, I think that there's real opportunity for reform.
Right. But I just want to be clear, when you say the clinical versus the economic, in fact, relying on clinical judgment, according to our best evidence, save money. It didn't cost money. These two things were not in tension with each other. When used appropriately, they seem to reinforce each other.
Absolutely agree with you, but the prevailing CMS payment methodology is currently DRGs.
Well, so that's why we're talking about alternative ways to do this. And I thought perhaps you'd like to weigh in on this, Mr. Armstrong?
Yes, I mean, I think as stated in the opening remarks, the 3-day requirement was implemented years and years and years ago, and it just continues to be on the books. But as my colleague on the panel just spoke to, in Bangor we have Eastern Maine Medical Center, which is a pioneer ACO, and they're not required to do this. Other programs like the PACE program, for a program for all-inclusive care for the elderly that operates very successfully in 29 states, including successfully in Massachusetts and Rhode Island in the New England area. They don't require the 3-day hospitalization because they have a capitated payment for Medicare and Medicaid for the residents that cover a whole host of services to keep people at home, or if they have to go to a nursing home, like I say, directly without going to the hospital, the PACE program pays for that. So there are currently other CMS programs that don't require the 3-day hospitalization at all.
And as you rightly point out, and within that, there are other ways to manage the access question so that we understand we don't want to have overutilization. We want to get appropriate utilization.
And for example, the 3-day hospitalization, say just one of the triggers now that qualifies for someone, they still have to meet the need for skilled nursing care or skilled therapy care or a combination of those to qualify for skilled care in our facility. So if you waive the 3-day requirement altogether, they'd still have to meet that criteria to need the service, and that's currently already in the CMS requirements for Medicare reimbursement. So if you just did away with the 3-day requirement, they'd still be required to meet the need for the service before we could provide it.
Good. Well, thank you very much. I have more questions on this, but I'll wait for the next round. Thank you, Madam Chair.
Thank you. Senator Baldwin.